Okay, next up we have Tadgh Daly, who again will be known to most of you. Tadgh is Chief Executive of Nursing Home Ireland, which is the representative organisation of all voluntary and private nursing homes in the country. I think it now represents over 3/4 of all nursing home beds, so a growing sector. And Tadgh is going to talk about supporting the continuum between home and residential care. Okay, I'll give you a nod of 17 minutes.
Well, you normally know I can talk for not long.
Okay, well, we won't let you today because the small things we had. Are people feeling a bit warmer? No. A little bit warmer. Okay, we'll get you to your coffee break by 11:10, okay?
Okay. Thanks, Sarah. Again, very pleased to be able to thank my home care for inviting me. When I did get the invitation, I was saying, why are they asking me to speak at this conference? They're probably sitting there saying the same thing. What is the nursing home guy talking about? And what can he tell us about home care? But I suppose what I want to leave any message with you today, it's about the complementary nature of what we do. Because I think one of the dangers that we will fall into if we're not careful is that people will start pitting one against the other and suggesting somehow that it's residential versus home care or home care versus residential. In fact, nothing could be further from the truth, given the aging demographic, given the large numbers that are requiring care, and given that we ourselves as we age will require a whole range of services to meet the needs of that aging population. So I'll try and keep it as short as I can, but also as engaging, as interesting as I can. No. Yes, just a quick, I won't bore you a bit about ourselves. This will be available afterwards, but who we are, as Sarah said, a representative organisation for the private and voluntary sector with 252 member homes out of something short of 440, and our service is what we provide. Our vision, our commitment, in keeping with John, I think it was important that we throw that in there to say what we do and what we stand for. Again, you can read it in your own time, but it's about in essence, providing leadership, supporting members, and promoting excellence. The members' commitment, again, kind of vision, mission, and we'd like to think that all our members subscribe to this, but not only subscribe to this, but deliver on that very, very commitment. And obviously, we see ourselves as an organisation in partnership with a whole range of stakeholders. No man's an island, as the old saying goes, and we don't see ourselves as having the monopoly on wisdom as good and all as we are. We do work with a whole host of organisations, and we see ourselves in that advocacy space on behalf of all our people. Yes, we represent the operators. Yes, we would be sometimes seen as the private sector, but at the same time, we'd like to think that all of our members and indeed us as an organisation have at the core and at the principle is that we want to provide the best possible services to our aging population. So in terms of the nursing home sector, two of the significant developments in the last number of years. 2009, John talked about being ready for inspection and regulation. Thankfully, in our case as well, 2006, the IHIPA was established, and 2007, there was draft standards. So again, people knew what was coming down the track. But the two of them happened at the very same time. In July of 2009, we had independent registration and inspection by HIPAA, and in October 2009, we had the Fair Deal Scheme, which is the nursing home support scheme, the financial deal support for all people. As I say, two very significant, but largely positive developments. But again, not without their challenges. You throw a rock into a little of a pond, and the ripples go up far and wide for quite a long time. And that's something which is very true of both independent registration and inspection, and indeed the Fair Deal Scheme. Residential care, as I say, is now independently regulated, and it is arguably the most highly regulated area in the health sector. Obviously very public, the inspections are available online, people can now choose on the basis of the information that HIPAA provides. And we would support HIPAA in that mission of robust regulation. We will also say that they need to be consistent and proportionate. And we will have some concerns around those two issues, and this is not about attacking HIPAA by any such imagination, but it does have to be consistent. And those of us, some of our members will operate in different parts of the country, for example, like yourselves in terms of home care, we operate in different regions. The absence of consistency is a significant issue. And again, obviously, we're dealing with human condition, We're not sending robots out to do inspection. That's always difficult. But it also needs to be proportionate. And HICWA, on their first 15 months of inspection of the residential care sector, said the most recent inspection experience across the sector highlights the productive cooperation of providers with the regulator in both delivering quality outcomes and improving standards of care continuously over time. That's what HICWA have found in the first 15 months. So I think that's something which we're very proud of, and our members are very proud of, that the fact that HICWA have understood and have, I suppose, in effect, come out and said that, notwithstanding what the public at large might believe about standards in residential care, in fact, the opposite is the case, is that the vast majority of operators and providers and the vast majority of designated centres, as they call them, operate to a very high standard. In terms of the changing role of nursing homes, again, this is something I could talk all day about, but in fact what you have is increased dependency levels, so people, by virtue of the fact that there's now a very well-developed, I think 53 was the number John talked of home care providers across the country providing care in the home, where people want to stay. But what that means is that when the time comes, when the level of complexity or dependency is when they do need residential care, their dependency level and the complexity of that care is much higher. So there is, I suppose, in some respects, increased specialisation within the sector. Dementia care obviously is a huge area. Again, the TCD did a survey a number of years ago which suggested upwards of 70% of all people in residential care will have dementia. Many of those undiagnosed, unfortunately. And the age profile of nursing home residents. There's something of a misnomer when you look at the figures, and I'm sure I wasn't here for Tony O'Reilly's presentation to you, but when you look at the figures, people say, well, 4.5% of the population over 65 require residential care. In fact, over 65 is a complete misnomer. Many of you and your family, your friends, and your parents live long beyond 65, I can assure you, and have very active lives long beyond 65. So this 4.5% over 65, as I say, is a complete misnomer. What we find in the nursing home sector is that, in fact, the age profile now you're looking at is the over 80s and the over 85s. And again, that ties in with the complexity of the dependency level. And within that, a reduced length of stay. The average length of stay a number of years ago would have been over 4 years as time forward. And the most recent figures I've seen in respect of Fair Deal and Fair Deal only is that it's over 3 years. And again, that would concur with the scheme itself in terms of the asset contribution being capped at a 3-year period. So I suppose in terms of why I'm here today is to talk about that whole community care. And I'm very strongly of the view that what we do need to develop as a society is that whole continuum of care. And as I said at the outset, if we allow ourselves to get sucked into a debate about residential versus daycare versus home care, I think we've lost the plot, to be honest. And the Minister of the Day, and indeed the HSE's Director General and the Directors of Social Care would love nothing better than to have the home care providers and the residential care providers to be arguing the task. But in fact, there's a much bigger argument at play. And the argument, in my mind, is it's acute versus community. That's the argument. Because there's lots of people in the acute system who shouldn't be in the acute system, they should be out in the community. And by the community, I mean that broad community. So it's daycare, respite, rehab, convalescent care, short stay, intermediate, and indeed independent living, which is something that Ireland as a country and as a society probably hasn't embraced, as it were. Maybe the next generation won't be as tied to their homes and areas that they grew up in, but that's something that we do need to look at. And not only provide a whole wide range of these services, but less so, I would, unfortunately, in the last number of years, because the demand for long-term care impacts on the availability of these services. I'm sure if you go to your phone this morning and try to find a nursing home bed in Dublin for long-term care, there's some difficulty. But I would say to you that if you were to ring and look for a short stay bed for a number of weeks or respite care, it would be practically impossible to find a short stay or intermediate care bed. And rehabilitation, I talk to members all the time. People that come to nursing homes and by virtue of an intensive program of rehab, activities program, etc., that person can return home. So I think we need to be also talking that language of that continuum of care. That people can enter residential, but can also be discharged from residential. There are things that we should be talking about with these supports to ensure that people can do that. But the big issue, I suppose, that you know very well around access to daycare and home care, independent living, etc., it's discretionary. The access, there's no legislative base there. The nursing home scheme has a legislative base. There is legislation which says that if you're assessed as requiring long-term care, then you will be provided with a funding stream. So availability is unclear and inconsistent right across the system. It reminds me in some respects of, it's even worse than the old subvention scheme that was operating in the residential care sector. And as I say, the impact of the demand for long-term care is very significant. Again, you know about the Fair Deal. I don't want to go through it in great detail, but it does, the outline of it by Mr. Harney at the time. And to be fair, I think Mr. Harney sometimes gets a lot of criticism for her tenure in health, and I'm not here to praise her, I can assure you, by any stretch of the imagination. But I think it has to be acknowledged that in the Fair Deal, she did set out to introduce a scheme that was, as she said herself, affordable, accessible, and anxiety-free. So her legacy, if you like, in residential care would be very, very strong, I would argue, by virtue of both independent regulation and also in respect of the Fair Deal. And because of the assessment and the criteria through the comments of your assessment record, what you do find is the high and max dependency people who are being approved for nursing home care. As it should be, because if people can stay in their own community, in their own home for as long as possible, that should be affordable. And that's the underlying principle as well of the Fair Deal, is resident choice. And that's something which is absolutely critical, I would argue, in terms of the broad range of services. It's enshrined in the legislation. We as an organisation lobbied very hard at the time. And thankfully there wasn't much opposition to it, the issue of resident choice. So when a person is approved for the scheme, they're given their list of providers, they're said, there you go. You choose on the basis of your needs, your desires and your wishes. So it's not someone being sent or being forced into one particular home or another. Again, just some figures on the scheme. It has a legislative basis, as I say. It replaces the subvention scheme, significant milestone, and there is clear and uniform support for long-term care. And it has been, I suppose, successful in inverted commas of the word. On average in 2013, 876 applications per month for residential care under the Fair Deal scheme. And at the end of 2013, there was almost 24,000 people approved at the year end. Across public, private and voluntary. The Fair Deal scheme doesn't apply to private and voluntary only, it applies across the full spectrum. And so the big ticket issue, if you like, from the private and voluntary point of view is the cost of care in public units, which is the elephant in the room. And I know that from your own point of view as well, in the home care sector, the cost of state-provided home care is significantly more expensive than private and voluntary provided. Likewise in the residential care sector, the average cost of care in public units, I've seen some figures of around €2,500 per week, whereas you have National Homecare Conference come out speaking to our members, negotiating and trying to argue for fees of €700-800 a week. So it's a huge issue, and when they have a limited budget, what it means is that 50% of the budget is going to, maybe 20% of the people who are supported. The Fair Deal review is on at the minute, and the reason I put that up there is because if you look at the last line of it, I mean, what they are saying from the home care point of view is that to ensure that it best supports government policy and how residential and community provision would be balanced as part of that program. So there is an opportunity for the home care organisations and home care providers into the future. I'll come to it in a minute, and in our submission to Fair Deal, we would have argued that it should be a mirror scheme to replicate Fair Deal, which would have its own legislative basis to provide a statutory basis for home care provision. So the key issue for me, I suppose, in terms of that continuum of care is the ageing population. And I understand that Tony O'Brien spoke of this earlier in terms of the language we use around older people. And again, that's something that we have spoken to the press council, for example. I mean, this term bed blockers is a most awful term to use. And likewise, this demographic time bomb. I mean, aging is something we should be celebrating, as I've said here. It is something to be celebrated. The fact that people are living longer, have access to therapies and medicines, etc., to live longer is something we should be celebrating. But of course, always it's painted as the problem of aging, the challenge of aging. It should be celebrated, but it also should be planned for. And that's something that, as an organisation, we are keen to advance, and I think we can do so very much in harmony with the home care providers. The figures there speak for themselves, and from our point of view, I suppose, the figure that would draw your attention to is the over 85 plus. Because again, the under 65 from a residential point of view is something of a misnomer. But in the next 7 years, the population over 85 is going to grow by 46%. The over 65s growing by 31%. So we can't ignore it. It's a bit like John saying that regulation is coming. This is happening. It's happening every day. All of you are 2 hours older than you were when you came in here this morning. And you're going to be aging as the day goes on. And by the time tomorrow will be older again. So we can't stop it. Nor should we try to stop it. But what we should be doing ensuring is that we plan for it. And that's something that we haven't done to date. Again, I could put up 150 slides there like any other presenter and talk about figures, but this will be available. You can look at it in your own time. What you haven't decided is the over 65 and obviously the over 85, which is the area in relation to the aging demographic. Just conscious of time. Again, the service plan for 2014 talks about aligning the model of care towards home and community. So it was, much to our disappointment, I must say, in Nursing Homes Ireland, money taken from Tadgh Daly to direct it towards home care services. And we're not saying for a second that home care services shouldn't be supported. We absolutely are. But it's a fool's paradise if you believe that by taking from one area of community care and giving to the other area of community care, that you're doing something. You're moving the chairs around. That's all you're doing. The real issue here is the cost of acute care. The cost of an acute bed of the order of €8,000 per week, €1,100, over €1,100 per day. That's now in statutory instrument. So €8,000 per week. That's where the issue is, and that's why we have large numbers of people in our trolleys and in our A&Es, and that's why we have even issues with ambulance, because people can't get access to the acute system, because there's people in the acute system who should be out in the community, and by community I mean that broad community. Okay, sorry, yeah. So again, Cardiff Centre for Aging Research and Development in Ireland made that point in their report in 2012 done by TCD, and they said, even with greater emphasis on care at home and more resources provided to realise it, the demand for residential care is going to increase. And likewise, Age Action Ireland in December, when again the point was making about moving money from one area of community to another, what they're saying is that it will affect the sickest of all people in terms of their access to residential care. And again, I suppose the point I would make is that assessment, John mentioned this issue of assessment. Older people, and indeed younger people, are not a homogeneous group. We're not running around and saying, you know what, that group of 65 in that particular area of the country are home care. That area, everybody is individual, they should be assessed as individuals, and that care package provided them on the basis of their requirements, and on the basis of their passage, if you like, through the health service. And the National Positive Aging Strategy will talk about what we would argue very strongly for is that continuum of care. So, as I say, it's not about residential versus home care. I think if there was one message to leave with you today, that's the message I would leave with you. Because we can't and should not allow ourselves get sucked into that false debate, if you like. What we do need to do is develop a true continuum of care, and we do need independent registration and inspection of home care services, which most of you yourselves want yourselves. One of the developments as well in the service plan for 2014 is the development of a single assessment tool, which is due in the last quarter of 2014. Many of you will be aware of that. But what that's doing again is back to the point of assessment. What we need to do is assess the individuals and ensure they have the right package of care at that time in their life. It may mean a package of home care for a period of 6, 8, 12, 14, 24 months, and then it may be some rehab, and then it may be residential care. We do need to ensure that the care package meets that individual's needs. As I said, we would recommend and argue strongly that there should be a separate scheme for community care that mirrors the Tadgh Daly. a uniform assessment, equitable access, dedicated arrangements funding, and a co-payment model. And then just last week, or 2 weeks ago, Professor Des O'Neill talked about the lack of planning. And that's something that we have been very active on as an organisation over the last couple of years, is this issue that, we can somehow ignore demographic and hope that it will go away. The reality is it won't go away, so what we do need is to plan for that aging population. Some of you may have been literally 30 seconds there. Some of you may have seen our report. We have some copies out there in terms of the planning for that aging demographic, the demand for residential exceeding supply, development of the continuum. We do need a cohesive national strategy for our aging population, because the implications of inaction are absolutely horrendous, to say the least. So, thank you all for your time. Sorry for rushing there in the end, but I'll be around for a while after if anyone has any observations or comments.
Okay, thanks for speakers. We've done a bit of catch up. I'll take a couple of questions from the floor, unless you're all dying to go for conference immediately. Do we have microphones? Okay, well, we just asked you to talk loudly. Okay, this woman here, who I wouldn't let in before, so probably. Yes.
Sorry, you
Speak up, sorry. Can somebody recruit somebody to get to the mic? Sorry about this.
So you're what kind of homework should you give us to take away to get ready for this national debate?
And to a chairperson.
You can ask one of the others who may have an idea of how we should get ready. And for example, we're running focus groups with our clients over the next few weeks. We could have questions to ask them. I feel that the HSE are ready to give a big direction for us, but I'm not sure that we're informed enough or ready yet for it. So it was a very nice reminder.
Do any of the others want to respond to anything from the floor? No. Okay, I'm so good. The national debate, my understanding of it, in the context of the publication of the white paper on universal health insurance, which was due early in the first term, and 3 years later it's as yet uncovered. I've seen and reported on and written about the draft white paper. Obviously I haven't seen the final version. It does provide a sort of map of where the Minister and the government see us going in terms of universal health. But it's not just about it, but everything, of course, is connected to that. And critical to that, I think, is social care services. So they're non-acute services, how they're going to be funded, and what sorts of services we want. And as part of it is going to be these various different consultation processes. And I think that's what Tony was referring to in terms of getting people, that is, in a way, you're throwing it out there and it's up for grabs. And that they really want people to have an input into what type of health system we want to have, and for that not just to focus, as it always is traditionally, on hospitals, but a much broader model. So I think there is scope for people, and there'll be, I guess, written submissions, but also I think there's going to be, national meetings or town hall meetings and a health assembly or something, and also a lot of this community here. So I think there is actually an openness at the top to having a say in how that's structured, and I think that's because they haven't worked out the detail. So I think that will be the case. Any other questions from the board? One here.
Just one virtual thing I want to clarify.
With
with home care, there's with home care, there's sector, and just to clarify, there's three different areas in Ireland that are national home care. We've got the private providers, which are kind of the to advertising, and then you have the HSE themselves through home health. They also provide home care, enhanced home care packages and home health hours. And then you've got the voluntary sector like ourselves, who we actually, as part of our unit, provide some home care as well. So there's three different sectors. Also private providers is at least 200. So it's not 53, just to clarify that. And there's multiple on everything else as well. So it's a much bigger area. And also in relation to the market, I today have the market. I just want that, so we do great talk about quality assurance.
Thanks for that. I'm sure it's not the audio man's job to give out the mic, but anyway, I'll recruit the mic person to lecture.
Thank you very much, Second Murphy, CEO of National Homecare Conference. I was listening with interest to Paddy's presentation and John's presentation there. Unfortunately, I was in the room for you, but what I was interested in, Paddy, having gone through from 06 to 09, the whole process of standards, regulation and oversight, and looking at the home care sector and facing into the next 4 or 5 years, what advice would yourself and John give to the sector in terms of preparing itself, in terms of setting out a roadmap, because it's based on your experience and learning there of that number of years?
I suppose the point I made everyone, and the John did point as well, was that you need to start planning out, waiting for the regulations to be written or the standards to be devised. It's not something that should happen now either. In our sector, back in 2006 at the time, we engaged actually with EIQA at the time in terms of the Q mark, and we developed a specific Q mark for nursing homes. It's still going, but it was, to be fair, the John is right, the ISO, so the ISOs and other of those, but they're very valuable. They're sometimes maybe a bit too broad, and they do need a bit more tailoring. So we did develop that ourselves because we were keen to establish among our own membership that commitment, saying, you know what, we're not waiting around for this to happen. We're going to take some steps ourselves. And then obviously we were in the position whereby the draft standards were produced back in 07. So it was about an 18-month lead-in time before the draft standards and the new regulations came into play. One of the challenges which, looking back at it, was an issue from the department's point of view was that the standards were published first and the regulations were written afterwards. Whereas in fact what should happen is the regulations should be written first and the standards should come up the regs. So what you have is the standards were saying things that would be desirable, etc., whereas the regulations were saying this is what you absolutely have to have. So there was a bit of a dichotomy there in terms of both of those. So, I mean, in terms of advice, it's a lot of you are doing it already, I would say to you, in terms of stakeholder engagement, listening to your clients and residents, but also the role of leadership and governance. I mean, if you talk to the authority in terms of HICWA, one of the challenges in the sector is recruiting and retaining high quality staff, high quality committed staff. And if you do have a centre where you have a very knowledgeable, enthusiastic, capable director of nursing, for example, in a residential setting, and that person leaves and maybe go elsewhere, and someone else that comes in might not have the same skill set or might not have the same ability on part of it, things can slip. So leadership and governance is a big issue in terms of staff support, staff. But a lot of the information is there already in terms of the safer, better healthcare standards. Because HICWA at the moment are revising the quality standards for residential care, and it's on that model, the 4 top and the 4 bottom, the resident side, and then the governance and management review organization.
You're taking up to me, cut it from short to the thanks, bye.
Also, it's a little bit interesting listening to Tadgh that history distills the mind. And I'd love to think that was actually the way it happened, that the nursing home said, this is fantastic in 2006. We're so ready for this. We're so looking forward to it. Think when you arrived, thank God. I remember in 2008 being at an NHI conference where it was like tar and feathers were being lit, the torches, the pitchforks were out. There were people roaring literally and said, we will not let them over the threshold. That is true.
All too good.
However,
Here comes like the name of the
however, the positive is that they did embrace that and they did pick it around. And that's, I think, one of the things that has to be considered, first of all, is acceptance. Is acceptance and saying, yes, this is going to bring huge changes, but it's something that will improve the way we provide care. I would always say, and I agree with them, having worked in so many nursing homes, the nursing home care now, from 2009, is hugely improved. Hugely. And it wasn't that there were bad people in the nursing home industry. I've rarely ever come across someone who had a bad streak in them. It was just that lack of, God, this is what we need to do. We need to step back from what we're at, we need to focus, and we need to move forward. And that would be my one word of advice. Take that time to step back, you have the frameworks, you have the information, start working on it and use it. And leaning on the governance aspect of it, your governance structures, because you have so many staff and such flat governance structures, going to be one of your key terms.
But just to be on that point, Darren's absolutely right. I mean, I use the word in terms of what we try to do in HI is provide leadership. And that's what the home care sector needs to embrace, is that leadership of its own members. Because the phrase I would have used at that time, against those two individuals,
Don't say
there's a point from looking at is that the phrase I would have used at the time was the training is necessary. That's exactly the phrase I would have used. So anyone thinking that it ain't going to happen or that I'm going to do things differently, they're fooling themselves. So, prepare.
On that note, can I suggest